Hello, my name is Isaac Daimiel, and I am a consultant radiologist at Guy's St Thomas Hospital in London, in the UK. And it is my pleasure today to briefly talk about a recent work conducted with the colleagues from Memorial Sloan Kettering Cancer Center in New York, who I want to thank for all the hard work. First of all, I want to start talking about the rationale of this study. As you probably know, the role of abbreviated MRI protocols for breast cancer detection has been increasingly supported by the evidence. Comparable results to standard full breast MRI protocols have been proven with the advantages of shorter examination and also interpretation times. Yet, abbreviated protocols have been poorly studied in high-risk patients, especially in those who are BRCA1 or BRCA2 mutation carriers. Also, there is still uncertainty or is still unclear whether T2 weighted sequences are necessary or not in these protocols. And these two questions have been addressed in our work. To give an answer to these questions, we compare the diagnostic performance of the standard full breast MRI protocol in our institution to two theoretical abbreviated protocols with and without inclusion of the T2 sequence in patients with BRCA mutations. First of all, we retrospectively queried our database at Memorial for BRCA1 and BRCA2 mutation carriers who had a breast MRI screening examination with the full protocol between January 2014 and October 2015. We found 1,700 scans, of which we excluded 1,273 examinations based on the clinically reported BRCA category and a existing histopathology or follow-up. The final sample included 292 women with 20 cancers and 427 MRI examinations. 4 breast-dedicated radiologists read the standard full protocol and 2 theoretical abbreviated protocols in 3 different sessions, separated at least 3 weeks after the end of each session. One of the abbreviated protocols included fat-suppressed T1 pre-contrast, post-contrast, and MIP images, and the other included an additional T2 weighted sequence with fat suppression. Readers were asked to assess BRCA category and a probability of malignancy from 1 to 100 for each scan, and also the interpretation time was recorded. And this is what we found. Comparison of sensitivity among protocols showed no statistically significant differences. However, pool specificity was significantly higher for abbreviated plus T2 compared to both the standard and the other abbreviated protocol. On the image on the right-hand side, we present an example where an enhancing no-mass lesion was categorized as benign based on the high intensity of the two T2 images. Pool PPB was significantly higher for both the standard and the abbreviated plus T2 compared to the other abbreviated protocol, whereas no significant differences were found for MPB. In terms of the accuracy, the pool accuracy was significantly higher for the standard protocol and the abbreviated plus T2 compared to the abbreviated the other abbreviated protocol. No differences were found among protocols for area under the curves. As you can see also, the interreader agreement was moderate for all the protocols, being higher for the abbreviated protocol plus T2. The median interpretation time was highest for the standard full protocol and lowest for the abbreviated one as expected. Finally, the conclusions of the study. We found that the abbreviated protocol without T2 images had suboptimal performance for breast cancer detection despite of having the lowest interpretation times. However, we found that the addition of T2 images to this protocol showed comparable sensitivity and accuracy with a small increase in specificity compared to the full protocol. Based on the results of this study, we suggest that abbreviated MRI with T2 images could be implemented for the screening of BRCA patients with MRI. I hope you enjoyed this presentation, and I encourage you to read this interesting article. Thank you so much for your attention.